On the Medical Watch tonight, an unexpected benefit for infants in the pandemic.
Yeah, hospitals across the country saw fewer premature births. WGN medical reporter Dina Baer has more.
Babies who are born prematurely can have a host of medical complications. And while doctors don't know exactly why expectant mothers carried their babies longer during the pandemic and quarantine, they suspect the positive habits stemming from infection avoidance may have played a role.
I remember thinking, where are the preemies?
When the pandemic hit hard, the message went out early and often: wash hands. The hyper-hygiene practices washed out impurities for mother and baby and appear to have dried up the population in the neonatal intensive care unit.
First thing I thought it was just infection, that maybe women are more conscientious with hygiene, hand washing, distancing. We know infection and inflammation can be precipitants of preterm labor.
Stress and the hustle and bustle of work and family-filled schedules was all halted as stay-at-home orders went into effect.
Maybe they're not actually on bed rest, but women are home, they're resting more. There's less of that going back and forth to work, on your feet all the time. So those were our theories.
While no formal studies were conducted on preemie levels plummeting, the numbers spoke volumes.
We were down about 60% from where we were last year for 2 months. And now we're seeing a resurgence again. So June and July, the numbers are back to where they normally are.
Rush University Medical Center saw the biggest preemie decline locally during quarantine. But other hospitals recognized a trend lower as well, including Northwestern's Prentice Women's Hospital, Lake Forest Hospital, and Northwest Community Hospital. Experts say they want to know why, so they can potentially harness the positive effect.
I do think we need to do a study across the country, because what I would like to see is understand a little bit better. Does it correlate with a time course of different cities shutting down, or with when the pandemic peaked in different areas? So I think that would be a very interesting and maybe helpful. If there's something that actually decreased the rate of prematurity, what was it? How can we replicate it? How can we implement it? And is it going to be effective?
Studies out of Ireland and Denmark also showed significant dips in premature births, but most of those studies ended before countries opened back up. As for Rush, hospital staff treated 1,400 hospitalized COVID-19 patients. Some wonder if expectant mothers avoided the hospital for fear of COVID and chose to deliver in smaller suburban centers. Back to you.